Good day, I'm Hazel Macapobre. Now let's proceed to fracture. So fracture, there are two types of fracture. So first is simple and the next one is compound. Now when we say simple or what we call closed fracture, it's a bone broken but no connecting wound from break area through the skin. While the compound fracture or the open fracture, bone broken with connecting wound to surface, bone itself may have been broken through the skin or a missile from outside may have penetrated the skin, then struck and fractured the bone. And it is also one which is the skin or a mucous membrane wounds extend to the fractured bone. So falls and motor vehicles accidents are the most common causes. So prevention, knowledge. So the frequency of a serious accident such as a fractures, the price especially to the victim himself or his family one serious accident may affect the entire life of a victims of the lives of his family. Now, creating a safe environment so that accidents may not happen. So learning and using safe methods, self-discipline is important for personal safety. So what are the symptoms of simple fracture? So first, swelling occurs whenever the organs, skins, or other parts of your body enlarge. His, it's typically the results of inflammation or a buildup or fluid. Also, swelling can occur internally or it can affect your outer skin and muscles. Now, the tenderness of area to touch, pain on motion about the injured area, deformity, and discoloration. So deformity happens when a body part is mishapen. Can also be a change for the worse in something appearance. So next is the what are the symptoms of compound fractures or the open fractures. So symptoms of simple fractures are present. A wound through the skin wound may be large or tiny. Bleeding may occur. Bone may occur or not still protrude. Pitfalls to drawing a correct conclusion. So you can see the image. The image. You can see the difference between simple and compound fractures. Motion of parts beyond the break may be freely done. Generally, motion immediately at the fractured area is possible, but this usually gives pain. Motion below the fracture is often free and painless. Thus, in an elbow, fractures in the fingers and wrist can be freely moved in many cases. So, essentials for first aid. So, this is intended for all fractures or possible fractures. So, keep the broken or possible fractures, keep the adjacent joint quiet, control shock. When in doubt, handled as fractures. So, additional methods for compound fractures. So, control. Control bleeding by direct pressure, perhaps digital pressure. Occasionally, tourniquet. Leave the tourniquet loosely in place in case before applying splint. So, apply sterile dressing to wound and bandage. So if a bone is protruding, try to handle the extremity in such a way that the bone will slip back under the skin. So as you can see the image, so you can see how to put the splint, which the fractures of the compound fractures is already have a splint. For transportation, A special apparatus for transportation may be needed rather than as usual spleen. Proper transportation method in specific cases whenever and wherever possible. In some cases, like fractures of the leg with tractions, the injury is suspended. So splint, arm slings, pillow, and stretcher or a combination are used. Splints should be padded. Splints should be sufficiently long. A common mistake is use splints that are too short. Occasionally, a victim must be moved a short distance before splinting. For example, from an automobile or a danger area. In such a case, someone should place his hand above and below the fractured area to keep it quiet, while others supports the weight of the body. Use of stretcher may be highly desirable. So improvise splints. So if splints are not at hand, good material for improvise, one should be soft. The first aider must be very often improvised. So material for improvising should be good. Heavy fence post irregular. So before we proceed, let me show you a short video about the first aid of fractures and compound fractures.
If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty.
So the causes of fractures are: it may indicate more serious effects to the brain, unconsciousness or partial unconsciousness for a short time or sometimes prolonged, cut or wheeling on the head due to blow, headache after the blow to the head, bleeding perhaps only an occasional drop from air canal, nose or mouth in severe cases. Pulse may be slow and fall, or in some cases rapid and weak. So pupils of eyes may be unequal in size. Face may be flushed or pale. Now, in the first aid treatment, so keep the patient lying down and quiet. Raise head and shoulders slightly unless patient is pale. Give proper care to bleeding and to wounds. Keep body moderately warm. Do not give stimulants. And lastly, proper transportation. So now let's proceed to the fractures of spine. So spine cord or the large nerve cord injury is sometimes present as a result of accident or improper handling. So what are the causes of this? So first is falls, even when landing on feet or buttocks. Car accidents, driving accidents, explosions, direct heavy blows, crashing accidents. So for the symptoms, backache or pain in the neck, sometimes the only symptoms. Swelling and tenderness. Paralysis or partial paralysis of one or more limbs or parts thereof is by no means always present. So occasionally severe shock. So now let's proceed to the first aid treatment. So support head and neck carefully, especially if injury is in neck or upper back. Slide patient upon the frame very carefully. If patient is found on abdomen or side, roll gently to the back, rotating her or his neck in lines as body rotates. For fractures of the neck, so place small padding under it. Use no head pillow, but place effective supports at sides of the head. For fractures of the back, place small padding under the back. Bind patients to frame. Do not bind, head, twist, or flex the body or the patient is set up. So the rigid frame may be placed on a stretcher or for transportation. So if a firm frame is not available, transport patient in a stretcher. Always lace on back, as this method is not as good as the use of a firm frame. In the neck fractures cases, it is much better to get physician to the scene for danger to life is especially great. If it is possible, first aider may well steady the patient's head throughout the transportation period. Don't let the neck tilt forward, sideways, or backward. Drive cautiously to a physician or hospital. Avoid jolting and sudden stops. Now, let's proceed to the fractures of pelvis. So, internal organ is occasionally also injured. Symptoms. Fractured part may have swelling and tenderness. Often these findings are not noticeable. Patients may have little or no pain when lying down, but especially in lower abdomen when trying to stand or walk. Gentle inward pressure by hands placed on both side or hip bones may cause pain in lower abdomen. So for the first aid treatment, so transport on back on a firm frame. So like this in the image. I can provide a video because wala ko provide a video. So bind knees and ankles together. Bend or strengthen knees according to comfort of victim. Now, let's proceed to the fractures of nose. So, what are the symptoms? So, first is pain. Siyempre, pain. Pain. Next, swelling, deformity, bleeding. So, on the first aid treatment, nose splint. So you don't have to put splint on your nose, no? Kay raman good siya, humok raman good siya. Pwede siya mabutang bandage. And wrist wound, bandage lightly in place with four-tail bandage. Always consult a physician because serious permanent deformity may result if fracture does not get proper care. Now, let's proceed to the fractures of the lower jaw, right here. So, what are the symptoms? So, pain of movement of the jaw, irregularity of teeth and possible some loose teeth, difficulty in eating, drinking, swallowing and talking, bleeding from the gums, mouth open when drawing of saliva. O, syempre, maglasod jud ka na, no? Kay jaw na gud na nimo. Kung ma-injured na siya diha, tigok ka. Charot lang. So, the first aid treatment. So, place the palm of the hand below the jaw and arise it gently to bring the lower teeth against the upper teeth. Support the jaw with bandage passing under the chin and over of the top of the head. So after that, immobilize the jaw with another bandage from the chin to the back of the neck. So if the patient starts to vomit, remove the bandages and turn the head to one side. Support the jaw with palm and of hand. So reapply bandage when vomiting stops. So now, let's proceed to the fractures of collarbone. Accurate naman na. Dira-dira yata ang collarbone. Di na makita. Fractures and can usually felt by passing the fingers along the collarbone. Swelling, of course. Possibly there are some deformity and tenderness in the area. So patients usually to raise arm above the shoulder and supports it at the elbow by the hand of the other arm. So if arm is hanging, the injured shoulder is lower than the other. So to treat your fractured area in your collarbone, so apply a rolled bandage under the armpit rather to raise shoulder slightly. Support arm with underslim. Tie the arm snugly to the side of the body cravat bandage. So that's all with my report, and I hope you learned something. Now, the continuation with my kagrupo. Now let's proceed to the next reporter. Thank you.